So you have waited for a long time for your baby to arrive, and now that your baby has arrived, instead of feeling super excited and so happy, you are feeling a sort of sad, lonely, and not so good. So I must tell you that it's not just with you; it happens with a lot of women. It's best of the times, and it is the worst of the times. It very well said by Charles Dickens, and it absolutely falls true for this situation. You are in the best of the times when you would have just felt so great that your little one has arrived. You should be happy and you should be at the top of the world. Yes, you should be. But at the same time, it is the worst of the times because just out of blue, you have started feeling sad and lonely and not so good. So that's why this is also termed as postpartum blues or baby blues. There is another condition which is a bit more serious one. This is called postpartum depression. And both of these situations just happen in the perinatal period. By perinatal period means just before the birth of the baby, and then it continues for a bit of time. So today in this video I will be discussing baby blues and postpartum depression. How are they different from each other? What are their signs and symptoms? When do they appear? And how to manage them. So let's move on to the first slide on postpartum blues. Blues versus postpartum depression. Baby blues is the first milder form of the things which we would be discussing in this video. So approximately say 40 to 80% of the women, they pass through this phase. So it's tremendously great proportion of the women who just have to go through these baby blues. So do not worry. So do not feel that you are alone on this path. And it is just a feeling of little tiredness, sadness, or irritability that creeps in just after the birth of the baby, say within usually first 2 weeks of the birth of the baby. And do not worry, and the good news is that it goes off its own, and no specific and no special treatment and medications or interventions are required for this. And the reasons are quite obvious, that there are changes in the hormones during the pregnancy and the birth of the baby that they are going on in your body. They cause this, and this is a tough time, and sometimes somehow things are drastically changing with respect to your body and hormones and everything, and sometimes a difficult delivery also predisposes to this sort of condition. And parents, especially the first time moms, they feel the pressure and stress and shock of becoming a new parent, and how are they going to manage this situation with respect to their baby. They get stressed, and thus leads to this sort of baby blues sort of situation. And sometimes problems pertaining to breastfeeding, lactation, like sore nipples, difficulty in giving feeds to your baby, and some sort of engagements, pain while feeding the baby, they also contribute to this baby blues, postpartum blues. And sometimes because of your pregnancy and birth, and thereafter the situation is that there are undue expectations between the spouse, the husband and the wife. So the relationships sometimes get strained, and these collectively say contribute to postpartum blues. But as I said, you need not worry for this. The news is that this gets off all right of its own. So usually these baby blues, they start within a few 1 to 2 days and last for 2 weeks approximately, and they get all right of its own. So this is about baby blues or postpartum blues. If you have any sort of questions on this topic, you can just write down in the comment section below, and I will be answering and reading all those questions myself. So let's move on to the next video, where we will be discussing postpartum depression. Thank you.